Is it true that heat-based devices can make a facelift in the future more difficult? And by heat-based devices, we mean devices like RF microneedling and therapy and thermage. The way these treatments work is that they use heat to create micro injuries in the deeper layers of the skin. Those micro injuries result in the deposition of scar tissue, which then creates collagen production. So whether they make a facelift more difficult or not really depends on which layer that this occurs. There's different techniques to doing a facelift. The most common technique these days is to use what's called a deep plane facelift technique. So if you're looking at the layers of the skin, you're going to have the epidermis, the dermis, the subcutaneous tissues or the fat layer, and then you'll have something called the SMAS, which is the supramuscular aponeurotic system, which overlies the muscle. In a deep plane facelift, the procedure is done in that SMAS layer. So if you're doing these heat-based treatments correctly, the heat should be deposited in the dermal layer. When you have this scar tissue and collagen deposition that occurs with these heat-based treatments, the thought is that it can make the lifting of the tissues more difficult when doing a facelift. If these heat-based treatments are done in the proper layers, then where you're targeting is actually in the dermis, sometimes maybe the subcutaneous tissues. So if you're doing a deep plane facelift, you're going to be below this level, so the dissection is not going to be impacted and it won't make the facelift more difficult. If the treatments are done incorrectly and they're in the layer where the facelift's being done, well, then you may encounter some excessive scarring and difficulty in lifting the tissues. The same can be said with treatments such as Sculptra, which is an injectable collagen stimulator. Sculptra is injected in the wrong layer or using the wrong dilution. It can lead to nodule formation or formation of little lumps in the skin, and that can also make the dissection of a facelift more difficult. So to summarize, can these treatments make a facelift more difficult? Sometimes they can, sometimes they don't. It all depends on which layer the treatments are done. Hope this answers your question.